Hello, everybody. Hope you're feeling fine. Hello, everybody. It's been a long time. Glad to be here again. It's been a while. I chose to do this video before I post the one I want to post so that I can explain the reason why I've been offline. I've not been able to post. So I was pregnant, I gave birth, like that, sha. So, just so you know, this video I'm about to post, I was pregnant when I recorded it. So, my phone was faulty. A lot of things happened, sha, that hindered me from posting it. So, I'm going to post it now. In case you see that you notice that my face is puffy a little bit. So, you get. Thank you for staying tuned. God bless you. Hi everyone, welcome again to my channel. So as you might have seen on the description, in the description box rather, about what this particular video will be about. So it's about story of how I was able to discover the lumps in my breast at an early stage back then in 2015. So sit tight and follow through. In 2015, I can't actually pinpoint my age then. I was around close to 20 years or so, or in between that 18-20 years or so. So I started having some pains, mild pains actually in my breast, one of the breasts. I think it was my right breast, yes. But I had some mild pains, and then at some point I felt like it was because I was wearing my brassieres too much, because then I liked putting on bras a lot. I felt it was because maybe I was putting on my bra for too long and all that. So I started reducing it. I don't wear it as much as I used to. So after then I noticed, okay, this thing is not stopping and all that. It's not stopping, and I'm like, okay, it seems like this thing is getting serious. I actually had no idea of what was going on. I've not seen anyone in my family member within my family member with such complaints also. So I was just like, what's this one? So I just ignored it totally till I started seeing it started scratching me. It started scratching me, and then like the areola side started scratching me, and I was like, it was so itchy that I would even scratch it, the thing will even peel, and I would start feeling pains and all that. So I had to call the attention of my sister. Yes, my sister, one of my sisters actually. I think I was staying with her, or I stayed with her at that particular time or so. So my mom got informed as well, but you know, mothers, we didn't want to scare her at first, so it was my sister that was involved. So when I told her, she was like, she doesn't really know much of what is going on. Maybe we should seek medical attention. So we did. I think it was my church then. There was a doctor in my church then that we went to meet. I think that was it. So he directed us to some places. We went there. They talked about something, surgery, and I actually didn't really know what was going on, but I was already getting scared already. So there was this place he directed us to. It's at Ikeja in Lagos State. The name of the place is Lista Medical Center. Yes. So I and my sister. Oh, before then, lest I forget. Before then, we actually went to General Hospital on the island, Eko. We went there, but God, when we got there, I picked like number 200 and something, and I was like, am I going to actually wait 200 and something? Am I actually going to wait till it's my turn? I will not sleep here. So my sister was just like, she doesn't think this is the best option for now. So on our way out, inside the same compound, yes, we just saw MTN they were doing this free mammogram examinations for women. Mammogram is like an ultrasound or advanced ultrasound for the breast. So we went inside. It was supposed to be free, though one of the guys there was like, we should pay a certain amount, but we later went in for free though. So when I wrote my name and did all the registrations, when I went inside to be checked, the person that was supposed to check me said he doesn't think I'm old enough to do the exam, that the exam is for women that are 33 or 30 years and above, and then I was still quite young, so we didn't do it. So he gave us a number, I think, of another hospital. I didn't go though, we didn't go. So from there we went to the other hospital that the doctor directed us to, which was Lister Medical Center. So another day. So when we got there, we paid for consultation and all that. We saw the doctor. He checked me. Yes, he checked me. He saw four breast lumps. Four breast lumps, guys. 4. I was scared. I was just like, what is going on? Many times, many people would just confuse breast lumps for cancer, without finding out what is actually behind it and all that. So in my mind, I was already praying that, how can I have this thing at this age? Like that, I was super scared. I was so scared. 4, not even 1, not even 2. So then he asked us to go for scan. We had to go for scan because he palpated me before he got to know the 4. So I went for scan another time, gave me another appointment date. So I went for scan, and the scan saw 3. But the doctor saw 4, or he felt 4. So I went back there again. He checked me again. He saw 3 that were big and 1 that was small. That small one is the one scan did not pick. So he said what the only solution they could do right then was lumpectomy, and that is the removal of breast lumps, removal of the lumps, lumpectomy. So I'd never done surgery before, so I was confused, I was scared, not only me though, everybody in my family, like everyone, all of us, we're like praying, and we're so scared. And the doctor was like, we have to schedule the surgery earlier, because the rate at which the lumps were growing, they were not giving it time. And then actually from that 2015, it was already 2016. As I time for the surgery, it was already 2016. It was already 2016. But I first discovered it in 2015, which I ignored it, which is not good. It is not good. If you feel lumps in your breast, don't be scared. Go for checkup, go for exams. Let them know what is going on. Okay, so let me continue my story. Guys, it was not funny then. It wasn't funny then. I was scared. So they scheduled the date for the surgery. I think it was around December 2016. Yes, I think it was December. So we had prayed. They already told me what to do before then. I shouldn't be scared, like normal doctor will say. So on the day of the surgery, I went there very early in the morning, by the way, very early in the morning when we got there. So the surgery was scheduled for 7:00 a.m. So as the time I got there, they were prepping me before the doctor came in. They had already prepped me. By prep, I mean they had changed my clothes, passed some IVs, something like that, IV fluids, something like that into my body. So I was already ready. By the time the doctor came, They had already set up the theater and everything like that. So they wheeled me to the theater room. I was scared. But I was pretending to be very strong, you know, because I don't want my sister to break down. Don't want my mom to break down. So it was my big sister, my big mommy. She was the one that was with me, and I think my brother, one of my brothers, I'm not totally sure again, or two of my sisters, they were with me. So they wheeled me to, pushed me wheelchair to the theater room, and then when we got there, I asked the doctor one silly question. When I saw them bringing out all these scissors, knives, everything, I was like, I just told him, I was like, won't I sleep? Will I be awake for you guys to do all these things? Doctor looked at me and he just smiled. He said, don't worry. Then I continued looking at them, and then at some point I just saw them putting some injections into the IV, something they've connected to my hand. So, and I started feeling sleepy. But I knew I was blank. I was gone. Though while I was sleeping, at some point I started feeling pulling, pushing, dragging. I guess they noticed because I was hearing them. I was already hearing them a bit. I heard them say, she's coming, or she's awakening. Sorry, like she's waking up. Then they added to the sleeping, what is it called? The sleeping fluid, whatever it is called. So they added to it, then I went off again. By the time I woke up, they were done. When I light off. So by the time I woke up, I was still in the theater room. So I just opened my eyes a little bit. I saw that my big mommy was beside me. Then like one or two doctors or nurses were there. Though they were trying to get my attention. They were trying to check if I was all right, you know, because of the sleeping IV, or what they call it, that they gave me, like that. So, and they left me in the theater room, you know, for observations and all that, just in case of anything, if anything should come up like that. So they were trying to check if I was fully awake. So they were trying to use their hand to, you know, to tell me to follow their hand, like that. They asked me whether I could see who was beside me, but when I woke up, my wasn't woken up, because the way I was just seeing Dublin, I was just I saw my big one beside me, and then I was seeing 10 of her. They asked me that who is standing in front of me. I knew who she was. I told the doctor that, okay, my big mommy was beside me, and then I told the doctor that she was 10 though, and they were laughing. They just told me to just close my eyes back and then wait a little bit, then open it again. You know, everyone was laughing. I knew she wasn't 10, but I was seeing 10, like that. Then after some minutes, they gave me some minutes to rest, and then they asked me again, you know. That time they were using their fingers. They asked me, how many is this? How many fingers am I putting up? At that point, I was able to see quite well. So I told them the correct fingers, the correct numbers, like that. So after then, they wheeled me back to the observation room. Yes, where they perked me. So they wheeled me back there. I was there for observation mainly. I was there for that day. I didn't sleep there. Yeah, they were not supposed to admit me because it wasn't really a major surgery like that. It was like a minor major, something like that. I don't know, but they don't admit. Yes, for that kind of surgery, they don't usually admit, since it doesn't pose any life-threatening risk or like that. So I was in the observation room. They observed me. They gave me some injections. I think, no, was it injection or drip? I think it was drip. So they gave me drip, I think so. So at that point, I could hold my phone. I recorded myself. I took pictures. Probably before I post this video, while editing this video, I will post some pictures I took or video, anyone I can find, or anyone I could find, or anyone I will find, anyone. So I'll post it whether on this side or on this side of the video. I'm going to show the picture or the video of that time. Then I was just thanking God that it went well. All my sisters, they were scared though, because the surgery took longer than expected. Yes, it was supposed to be like an hour to surgery, but it ended up being like 3 to 4 hours surgery. So because I think they found some other small ones also, but mainly the remote 4, mainly then maybe some attachments like that. So that was how it went. And then we went to my brother to coach home. That then they gave me like a week. No, was it a week or 3 days? I think 3 days to come back to check, so they could check no, it wasn't 3 days. I think it was a week, so that they could check the stitches and all that, and then clean it up. So after a week, I went back there. They checked the stitches. They cleaned it. They could not remove the stitches then. They said it hasn't healed up totally, because some people's own would have healed though. We have different body types, you know. So but mine didn't heal at that 1 week interval. So they shifted it. I think they gave me another week, or yeah, I think they gave me another week or days, I'm not sure. So by that time they gave me some pain reliever, yeah, and some antibiotics, drugs. Yeah, so after the other days they gave me a week, I came back. Then the stitches, they are not the normal type of stitches they use in the, maybe you have a wound and then they sew your body together. That blue one, no, not that. The one they use is more like strand of hair, and it usually melts, something like that. It usually melts. They won't have to remove. They only have to remove the place that they tied at the edge where they started and when they ended, I think so. So that was the only one they removed. It wasn't too painful. It wasn't painful, but you know, but just like a prick, like a needle prick, just, and they got over with like that. So after then, you know, just to go home and recuperate and heal. The plasters were still there, you know, because after the surgery for like 2 weeks while the stitches were still there, I can't fully have my bath. Like it's more of cleaning. It wasn't easy at all, you know, not being able to pour down your body directly, for, you know, you didn't get a choice. So that was how we did it. My son to clean my body like that, and then we pulled through anyway. We pulled through. God just helped us. So, you know, and because it was a private hospital, you know, they took care of us. We paid. Yeah, we paid though. I can't actually remember, but somewhere of everything close to almost a little bit above maybe 200k, I think so. Then with the medications too. So that was it. Then I healed. They told me to just rest, don't carry everything for, but you know, everything, just thank God and give God all the glory for, you know, the success of it all. We are here today. So thank God. So guys, that's about everything about the video. That's about everything about my first surgery. Yes, that's it. So in the next video, I'll be talking about the things they told me to do, the things they told me not to be doing, you know, so to prevent reoccurrence of the lumps. By the way, it came back again, but we are not going to be talking about that in this video. Yes, it came back again. I know you'll be surprised, right? You did. But we're going to be talking about that gist in another video. So guys, thank you for watching. Thank you for sticking with me. Thank you for listening. So I hope you were inspired. I hope you learned a thing or two from this video. So thank you. Don't forget to live, love, and inspire. Love always. Bye. Like, subscribe, and share. Thank you.